Hello, I'm here to talk to you about communication, specifically about a device we like to call Sbar. What is Sbar, you ask? That's a great question. Allow me to explain. S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. This tool is extremely useful for mediating interactions between healthcare professionals. The best way to understand Sbar is to see how it works in real time. Let's meet our patient Cindy. Cindy is visiting her OB-GYN because she has amenorrhea. Her pregnancy test came back negative. This is concerning for the OB-GYN because Cindy may have a low BMI. The OB-GYN will run a series of tests based upon a suspicion that Cindy might be anorexic. Let us outline how the OB-GYN uses Sbar in this patient encounter as a model for all future Sbar interactions. Watch her call the primary care physician. Situation. The situation is that the patient is experiencing amenorrhea. Her pregnancy test came back negative and she is significantly underweight. Background. Cindy is a 24-year-old female that has been experiencing this amenorrhea for the past 5 months. Assessment. The OB-GYN's assessment of the patient encounter is that the patient's amenorrhea is secondary to anorexia nervosa, based on the patient's BMI being less than 18.5. Recommendation. Recommend to evaluate for a full workup and treat possible anorexia. The PCP is the initiator of our patient scenario. PCP stands for primary care physician. The PCP confirms that Cindy has anorexia nervosa. Based on the case information, it is important for the PCP to admit Cindy to the hospital for escalated treatment. The PCP will continue Cindy's care throughout her healthcare journey by being in close contact with all of the other professionals managing Cindy's case. The PCP will utilize Sbar with all the professionals within her network. Passing the baton is a more comprehensive technique to transfer total patient care to an associated healthcare professional and would be utilized any time a patient is discharged or transferred to an outside facility. Because the PCP will not be following the case continuously, she will not utilize pass the baton. The PCP will proceed to order a psychiatric evaluation for Cindy. The psychiatrist will receive the request for a consult from the PCP when the patient is admitted and stable. After evaluating the patient, the psychiatrist will report the findings to the hospitalist, PCP, using Sbar. The psychiatrist will in turn find an appropriate licensed clinical caseworker. If the caseworker is part of the healthcare network, Sbar is an appropriate means for the psychiatrist to brief the caseworker. If the caseworker is part of another network, I pass the baton is acceptable. The caseworker will proceed with psychological testing and discharge management. He or she will monitor the patient for potentially lethal noncompliance. Since the patient will be transferred to an appropriate inpatient facility for ongoing monitoring, the clinical caseworker will have to use I pass the baton to transfer total patient care to the new facility.